بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك أنت العليم الحكيم. My topic today is about the central distribution of aerospace shadowing, bat wing appearance, the differential diagnosis, common, less common, and rare causes, and the clue for the diagnosis. Essential information: aerospace shadowing, classically described on chest X-ray, and also can be seen in the CT scan. Seen as bilateral perihilar opacities with relative sparing of the peripheral lung tissue. Clinical information is the key to diagnosis. The common causes of aerospace shadowing bat wing appearance is hydrostatic pulmonary edema, pneumonia. Helpful clues for common diagnosis: pulmonary edema, hydrostatic pulmonary edema, usually caused by increased pulmonary venous pressure. Most common etiology include left-sided heart failure and volume overload. Interstitial edema appear as curly lines, A and B and C lines, peribronchial coughing, and perihilar haze. Aerospace edema, patchy or diffuse aerospace opacities may be present as bat wing edema. Central distribution may be due to rapid onset of the edema and better lymphatic clearance of the lung periphery. Here in the chest X-ray, you see bilateral aerospace shadowing involving the both lungs. Here we see the central line, and the aerospace shadowing it is sparing the lung periphery. And this is the classic appearance of bat wing appearance due to left-sided congestive heart failure. Pneumonia can be seen in the bacterial and atypical pathogens. There is dense consolidation, may be seen air bronchogram. Here we see in the chest X-ray bilateral central aerospace consolidation, more to the left side in patient with immune compromised, and it is proved to be pneumocystis pneumonia. Less common causes, it is lung injury and pulmonary hemorrhage. Lung injury caused by drugs like cocaine, near drowning, smoke inhalation, and sepsis. Distribution of alveolar capillary interface lead to non-cardiogenic pulmonary edema, diffuse alveolar damage. Here we see in the frontal chest X-ray bilateral central pulmonary edema in bat wing distribution due to inhalation of cocaine. Here in another patient with the frontal chest X-ray with bilateral aerospace consolidation, little bit more to the right side with history of near drowning, and injury result to the lung in non-cardiogenic pulmonary edema, and history is important here for the diagnosis. Pulmonary hemorrhage in numerous causes that may present similar by radiograph. patchy or diffuse ground glass opacities or consolidation, often with central distribution, can present as ill-defined centrilobular nodules, especially on the CT scan. Here we see in this axial contrast-enhanced CT scan in patients with Wegener's granulomatosis, bilateral pulmonary hemorrhage, in distribution of bat-wing appearance, and the lung periphery is spared. And we see in some areas like here the crazy paving appearance. This is a ground glass opacities with thickening of the interlobular septal thickening in the left side lower lobe. Here, this is axial non-contrast enhanced CT scan with bilateral central area of consolidation in patient with pulmonary hemorrhage. And this patient the blood is aspirated through the NG tube. And endotracheal tube. Rare causes, but important, it is pulmonary alveolar proteinosis and acute interstitial pneumonia. Pulmonary alveolar proteinosis, most cases are idiopathic. We have airspace filled with proteinaceous material, interstitium is thickened, and we have a greasy paving pattern on high-resolution CT scan. Here we see high-resolution non-contrast axial CT scan with bilateral ground glass appearance with interstitial septal thickening, giving the appearance of crazy paving appearance. And this is distributed centrally with peripheral sparing, but it is not specific, and it is consistent with pulmonary alveolar proteinosis. Acute interstitial pneumonia, idiopathic disease resulting from diffuse alveolar damage associated with viral prodrome, also known as Hamann-Urich syndrome. Bilateral airspace, there is bilateral airspace consolidation that may be patchy or diffuse. Here we see patient with bilateral extensive ground glass opacities involving both lungs with geographic areas of sparing of the periphery, and this is consistent with acute interstitial pneumonia with the patient history. Thank you for listening, and hoping to see you soon in another topic.